Good morning, everyone. As many of you know, we continue to see a rise in cases, which is concerning to all of us. Going from an average of 25 per day last week to 72 cases reported Wednesday, 109 reported Thursday, and 84 reported today. We're definitely moving in the wrong direction. While we've taken steps to slow the spread over the last few weeks, including an advisory to limit social gatherings and requiring quarantine for any out-of-state travel, cases continue to rise. I want to be clear. We're in a new phase of this pandemic. The days of very low risk are over. So unfortunately, I'm announcing several new measures to slow the spread so we can protect the vulnerable. These steps are data-driven, meaning they're targeted directly at the areas driving our current case growth. As we've seen recently, many of our clusters and outbreaks are tracing back to private social gatherings like baby showers, tailgate parties, deer camps, and other small gatherings like barbecues where multiple households are getting together and not wearing masks or staying physically separated for long periods of time. It's no coincidence that we're seeing these increases 12 days after we know many gathered for Halloween parties. And though we've been warning against these activities for weeks, they're still happening. Given our recent case growth, we have no choice but to restrict social gatherings, whether at a home, a bar, or in a parking lot after a game. So, starting today, multiple or multi-household gatherings, both inside and out, whether in public or private spaces, are prohibited. I know this is incredibly discouraging, especially because many of you have worked so hard and we've had much success for so long. But the fact is, people getting together, not being careful, and letting their guard down is why we're in this position today. Our data shows these multi-household interactions are also taking place at bars and clubs. So effective tomorrow at 10 p.m., bars and social clubs will be closed to in-person service. Restaurants, however, can remain open, but are required to close in-person service at 10 p.m. each night, though they will be able to offer to-go service after 10. To assist with contact tracing, which helps us prevent and contain outbreaks, we're also requiring restaurants, museums, gyms, and other customer-facing establishments to keep a daily log of all who enter their facilities. We've also directed, we're going to be directing Vermonters to comply with requests made by the VDH contact tracing team because we need people to be cooperative and honest when they call. And as college students start to return home for the holiday break, whether from a Vermont school or out of state, they are required to quarantine for 14 days or 7 days and a negative test. Please note, we are strongly encouraging these students to get tested after 7 days. We've also seen some who are going back to our pre-pandemic ways. So we're requiring telework for those who can do so and discouraging in-person meetings. Essential workers and schools can continue in-person operations, but things like staff meetings that can be done by video conference should do so. Finally, we're pausing recreational sports leagues, those outside of the BPA sanctioned sports. Admittedly, this one is hard for me because our kids are trying so hard. but it continues to be another opportunity for gathering and can spread the virus amongst multiple counties and multiple schools. As we move forward, we'll be looking at this every week, and I hope youth sports will be one of the first things to reopen. And I hope these adults out there who haven't followed our guidance recognize the responsibility they have to help us slow the spread and get our cases down. I'm sure you all know we're at a tipping point. We still have an opportunity to get our arms around this alarming case growth and return to what we've grown accustomed to. But we all have to step up and commit to following the health guidance, including these new measures, and limit our contacts as much as possible. Now, at the same time, we're expanding testing and contact tracing protocols, so we're better positioned to hunt this virus down and stop it in its tracks. As I've said before, the good news is we've proven these steps are effective and that we can change our trajectory. And I want to thank those Vermonters who've done their part, who wear their masks, who skipped the Halloween party, canceled travel, and kept their social circles small. It's this type of commitment that will get us through this sooner. I know how hard it is to keep this up, but if we dig deep and double our efforts, we can get this under control. And we must, because this is about making sure we don't overwhelm our hospitals and save lives. It's about keeping our kids in school and our workers working. I know these are goals we all share, and we all have a role to play in order to stop the growing wave of infections, which is leading to more hospitalizations and sadly will lead to more deaths. So please, do your part so we can get things back to where we were before. And with that, I'll now turn it over to Dr. Levine.
Thank you, Governor. You all know that we rely on data to guide each and every decision we make. And that data has shown us a clear picture of a rising tide that could have serious consequences. We have now seen transmission accelerate as reported cases have gone from 42 at the beginning of the week to 72 to 109, hitting new highs of the pandemic in Vermont. Last evening, there were additional 84 recorded. Hospitalizations, too, are on the rise, with a total reported today of 21. You can see our total case count is 2,743, and our deaths remains stable, fortunately, at 59. Every Tuesday, we present to you a lot of the modeling data and projections. I want us to focus today on the real-time data. And you can make your own projections because you'll notice that the slope of the curve has markedly changed from where it has been for so long a time. This is the number of cases per day, which I've already stated to you. This is a pictorial representation. Clearly, we had some days that exceeded our early experience way back in March, after this long, long period of small outbreaks, containment, moving on. The percent positivity rate we have continued to be noteworthy in the country regarding how we are doing. We've often been below 1%. You'll see now that the 7-day average actually isn't listed on the slide, I'm sorry, but the positivity rate on November 10th was 1.76. I believe the 7-day average is between 1.3 and 1.5. Regarding syndromic surveillance, which is on the next slide, not a marked uptick, but you can already see that there is a change in the most recent days on the graph. Still at a lower level, but in some of our counties, the emergency departments have become exceedingly busy. So we anticipate those numbers will change. And then on my last slide, just to show you the nature of really the outbreak that began this entire progression, the ice sports team outbreak, way back here in October. Things have really settled down a little bit with regard to that, but they have not been extinguished completely. And we need to keep watching that. But I use this not to necessarily focus on that particular outbreak, but to focus on the natural history of an outbreak and what can happen with very innocent events that then lead to community transmission in ways that people may never have imagined. As you'll see, we've gone from what we call the primary grouping to the secondary to now the tertiary infections that are still petering out, so to speak. So just like we've had an increase in the number of cases, the same goes for the number of new situations our contact tracers are following. That can be a range of things that require more investigation and outreach than just a single case. These situations, we label them that way because they impact usually a kind of a facility, whether the facility be a work site, whether it be a long-term care or healthcare setting, whether it be a school or child care. Earlier this week, 8 new situations were identified in one day. The following day, it was up to 16. The current total is now well over 80. The current total of outbreaks is 17. Too many to go into one at a time for you here during the press conference. Our data team's analysis also shows a rising number of gatherings leading to further spread and outbreaks. These gatherings can be parties, meetings, cookouts, get-togethers with family or friends. Since October 1st, 71% of the cases that are associated with an outbreak are associated with an outbreak from a private party or a social gathering. 71%. So I've given you the data. I want to translate the data into a story. It's not one complete real story, as the way I'm going to tell it, but what it does, because every single component of the story is from real, actual scenarios that we've encountered just this past week in Vermont. It tells the kind of story everyone needs to hear. So let's start with a Vermonter. I'll name him Max. Max goes to his friend's house for dinner. There's a small group of old friends there, a couple of new acquaintances. He doesn't know where they come from even, but there's a couple of new acquaintances. And everybody's having a good time. No one really feels sick or seems sick to Max. What he doesn't know, of course, is that one person in that party was infectious at the time, probably in the 48-hour period before they might become symptomatic. And of course, Max is at a dinner party. What do you do at a dinner party? You eat, you drink, you socialize. So there are long periods of time when there's nobody wearing a mask, because how do you do those things with a mask on? And it's your friend's house, so you're not actually paying attention about how many inches or feet I am from a person. So Max comes home to his family, had a great time, but a few days later, he's not feeling perfect, but he kind of feels okay. Hasn't really noticed any major changes. But what he doesn't know is that he is actually infected now. And it's during this time, before he really realizes he's sick, that he can be infectious and infect somebody else and transmit the virus. But he feels well, so he goes to work. He owns an auto service shop. He's pretty good about wearing a mask and all that, but he and his 3 other employees take the same coffee break every day. And what do you do on a coffee break? Well, these 4 guys drink coffee, eat some snacks, and lament about the Patriots. However, during that coffee break, those 3 other co-workers are potentially infected. They're certainly close contacts, but they're potentially infected. The 4 of them are the entire workforce, so Max has no choice but to close his business for a number of days. Let's talk about his wife, Nicole, who he lives with, of course. She lives at home with him, doesn't know he brought the virus home from their friend's house when he was at the dinner party. The only problem is Nicole's a teacher. So Nicole goes to school feeling well as well, but has now exposed her 5th graders and some staff at the school to the coronavirus. Eventually, she actually develops a cough, so she has to get tested, and her test comes back positive. Now there's a pod of 5th graders and 2 staff members in the school that have to stay out of the school. Their lives are disrupted for those 2 weeks. Potentially, the school's operation is disrupted if there's an impact on staffing that becomes significant. So that's how that works. But I didn't tell you one other thing. Max and Nicole have a daughter, Vanessa. Vanessa works as a nurse's aide at a local nursing home. We know ultimately from our experience in Vermont how devastating an outbreak among patients there could be. Vanessa knows that too. She doesn't live a life in the fast lane. She has been very careful. But why would she imagine just coming home and living in her own home would put her at risk of coronavirus? I won't play it out any further, but you can imagine the impacts if the nursing home has an outbreak. So my story is all about one social gathering with a very modest number of people. And I'm not exaggerating this story at all. This is exactly what the governor talked about and what I've talked about that we are seeing every day in our reports in Vermont. And unfortunately, when the virus is increasing in levels in our communities, this is what happens. We want to be together, we want to have some sense of normalcy, but I don't want this to be your story or any of our stories. Both the numbers and the information contact tracers collect tell us where the solutions are. Limiting contact among households in gatherings and in following the travel and quarantine guidance. Period. Whether it's friends or our own family members, we need to limit any social activities to our own households to protect all those people that we can't even know we've put at risk. Where we work, where we learn, where people live in situations that might make them more vulnerable. And unfortunately, we need to make these sacrifices now. You may recall that on Tuesday, I told you that we were on the threshold and that the decisions we make now will truly determine our future as we head indoors in these colder months. If we can act at this critical moment in time, our actions will still make a difference. Remember our very basic priorities and goals. Keep people working, keep kids in school, and save lives and hospitalizations by decreasing the number of cases. I want to add that as much as we talk about protecting each other from COVID-19, it's a good time to really think about protecting yourself. We hear about some people having no symptoms and most people recovering, but there is still a range of outcomes from COVID-19, some with long-term effects, even for healthy people. And you just won't know how COVID will affect you until you get it. So please don't make assumptions with this disease. Take it seriously. I'm going to conclude now with just a few essential points. Know when you need to quarantine and what that means. Travelers, close contacts of a positive case must stay home and away from others for 14 days, or 7 days with a negative test, assuming you have no symptoms. It's especially critical now with college students coming home for the holiday. We strongly encourage them to get tested as well, and they must quarantine. I've received a lot of mail about this and had to explain a lot of times about what quarantine really means. So please go to our healthvermont.gov website under COVID-19. There's very explicit instructions about what quarantine is and isn't. Second point, get tested. If you have COVID symptoms or you're a close contact of a positive case, or as we've already said this week, if you've attended social gatherings, get tested. It's an essential tool to finding and containing COVID. We appreciate your patience as our teams work hard to make testing even more available than it is now, when and where you need it. Thirdly, know how to prevent further spread. Testing is not prevention. You still need to wear a mask, stay 6 feet away, and stay home if you're sick. That includes even a mild symptom like a headache or a runny nose. And avoid non-essential travel. Fourth, answer any call from the health department and be forthcoming with information. The more cases and situations we have, the more we need your help so contact tracers can do their work. The quicker and more complete the information, the more likely we are to stop transmission and prevent an outbreak. Our experience these past many months, and I showed you on the graph, has taught us that Vermont knows how to contain this virus. There's no question we're facing real challenges as cases surge in Vermont and around the country. We want to get back to where we were, but we need your help. Accepting our situation and following the guidance the governor and I have described today is what we must do now. We may need to be apart more, but I know that we are up to the challenge together. I'll turn it back to the governor.
With that, we'll open it up to questions.
All right, we have 25 in the queue, so please limit your questions. We'll start with Calvin.
Thanks, Governor. I'd imagine a lot of bars and restaurants probably aren't too keen to hear the news today. I know your administration's in the process of securing a few more $1 million for business grants. I guess, do you think that will be enough? And I mean, if people, I guess, especially with small gatherings, if they don't comply or we continue to see cases go up, I guess what help will be there for those restaurants and bars?
Yeah, well, first of all, the restaurants are not impacted. The bars will be closed, the clubs will be closed, the restaurants will be closed at 10 p.m., so they can still continue. But I have a lot of sympathy for the bar owners in particular. They're another business, and they have a lot of employees who count on them for their income as well. So this wasn't done lightly, and that's why I'm fighting so hard to take whatever remaining CRF funds we have left over, and we have about we've set aside 75 million for that sector in particular, and businesses at large, because we know they need it right now just to get through maybe in the next month or so. But it's not anywhere near enough. Not anywhere near. We need, just for the hospitality sector alone, I would say we need 5 to 10 times the 75 million that we have today. We just simply don't have enough to help. And we're under the same restrictions, the guidelines we had from before. Everything has to be expended by December 31st. So the clock is ticking. So we need to make sure that we get that out the door just as quick as possible. It's my understanding The Joint Fiscal Committee will take this up tomorrow morning or tomorrow at some point and either give us a red light or a green light in terms of whether we can use that money for these businesses that are in desperate need. And again, I just want to reiterate, this is nowhere near enough. We're going to need some more help from Congress. I've spoken to our congressional delegation about this. I, in fact, had a text exchange with Congressman Welch today, and he's obviously on board. He understands our needs and is doing everything he can to get them to act even in the lame duck session.
And then I guess just a question for Dr. Levine, dealing with college students returning. You said that every college student needs to be quarantining when they come back, but a lot of schools have been doing their own testing. So let's just say I'm a student, I go to school in North Carolina. I get a negative test there. I come straight here. I take a test. As soon as I arrive, I test negative. Do I still have to quarantine?
I wish I had an answer that you want to hear, but the answer is you must still quarantine because you've come from a place that has even a higher positivity rate than anywhere here in the Northeast. And the day you test negative is just the day you test negative. It doesn't imply that your body is not incubating virus and that you won't become infectious. So that 7-day period followed by the next test is really critical.
Thanks.
David?
It sounds like it's still possible with contact tracing to try and go after certain outbreaks and try and keep it from getting out of hand, but with the positivity rate increasing, how close is it to getting out of control? Is it possible to say how thin the margin is between being able to contain outbreaks with contact tracing and having the rate of spread get beyond our capacity to catch it?
Yeah, our contact tracers are busy, no doubt about it. And we've increased our capacity. We're going to continue to increase our capacity so that we can meet the demand and make sure that we protect Vermonters as best we can. But that's why we put some of these other measures in place to cut down on the number of cases so that we can, so that we do have the capacity to contact trace, because that's part of the answer. The testing, contact tracing is part of the mitigation. Again, everything has to work at the same time, but our contact tracers, the EPI team is very busy these days, and we need to all do our part to give them a break so they can catch back up. Anything either one of you want to add to that?
And yesterday, it sounded like Washington County was a bit startling with the number of positive cases that came out. As we look at the upcropping, are there geographic locations that appear worse than others? For example, is it Washington County, Central Vermont? Is it Chittenden County? What's the geographic layout?
Yeah, again, I don't know how specific we can get because it is widespread throughout Washington County, even into Orange County, into Chittenden County. But as you remember, as we laid out maybe a week ago with the outbreak at the skating facility alone, the largest outbreak that we've had in Vermont. I think it's gone into over 150 cases at this point. That impacted St. Michael's College. So that impacted Chittenden County. So that one event, that one action had a huge ripple effect. And it's my belief, and I don't have anything to back this up with, but I would say the number of cases we're seeing in Washington County today is a result of what happened about a month ago at that skating facility, because it's still having the first and second generations of the infections that we saw throughout. But I have nothing to back that up with, just my own personal feeling.
And finally, will there be, and what kind, if so, of enforcement with the new prohibition on multifamily gatherings?
Yeah, again, this isn't a perfect system. It's not as though we're going to have someone out trying to find people or to enforce. We're asking Vermonters to do the right thing here. They've done it before. That's what's so promising about all of this. In the initial stages of the pandemic, Vermonters stepped up. They did the right thing. They stayed home, stayed safe, wore their masks as we as we changed the guidelines along the way. And we had this under control. But what we're seeing as a region, what we're seeing as a country, this has exploded, and it's coming to our doorstep. And we have to do all we can, again, to take this on and protect ourselves and protect our neighbors, protect our families. Because I know, again, we saw it, we proved it, we can do this. But it's going to take all of us pulling in the same direction in order to be successful. So, again, it's not perfect, no enforcement system in some respects, but I'm confident that Vermonters will do the right thing as long as they understand what the mission is.
Thank you.
What kind of statement or action can you take, given the feds, the current situation with the incoming president-elect, who should be getting things going and up to speed, and a president who's stayed behind the scenes and really hasn't been seen other than one time since the election, and what seems to be inaction on the federal front on COVID since the election? How does that play into you're saying we need money now?
Yeah. Well, again, I just want to remind everyone from the start, we as individual states, we as Vermont, we took things on ourselves. We didn't have a lot of help in the beginning. We didn't have a lot of guidance, but we did a lot of the right things for the right reasons. We listened to the data, the science, and Dr. Levine and everyone else, and we did what we thought was right for Vermont, and we continued to do that throughout the last 9 months or so. So we'll continue to do that. We do need money in the future for our economy, and I'm confident that they will come to some agreement eventually. I don't know if it's going to be in this lame duck session in December, or whether we have to wait until the new president is sworn in. But I'm confident that Republicans and Democrats alike will come together eventually to provide relief, because we all need it. All states need this. But I also want to remind everyone that just because the president isn't acting and the president-elect isn't been briefed on a lot of issues, who should be, by the way, but the bureaucracy is still working. I'm sure Dr. Levine is still in contact with his others around the country, as I am with other governors, but the bureaucracy still works. The CDC is still there, and they're still doing their part. So I just want Vermonters to understand that just because the president might not be acting, the bureaucracy itself is.
But our elected officials in Washington, both on the congressional side and on the administration side, are pretty much stalemated. Nothing's happening. You guys are on the front lines dealing with this stuff. I was in a diner in southern Vermont yesterday, and the owner of the diner was doing the waitressing, the screening, the cooking, and the serving. And she's down to just herself now running this small diner, and she's saying, geez, you know, it's tough. It's really tough on these people.
Yeah, my heart goes out to all of those, particularly in businesses, and that's why I keep saying we need to provide some relief if they need to shut down during this, and we're asking, bars are going to be shutting down. They need some help, financial help, to make sure that they survive for another day, so that when the vaccine comes into fruition and is widely, safely distributed, that those businesses are protected so they can get there, so they can survive until we have some certainty on that front. So we'll continue. Again, we've done a lot of good work here in Vermont. We know how to do this, and if we continue to rely on our team, you know, across state government and our team across all Vermonters, we'll beat this. We'll survive. But we're all going to have to work together in order to do that. And we're doing just what we did from the beginning. Again, we didn't have a lot of help from the federal government in the first few months. And we learned how to, meander our way through this successfully. And we'll continue to do just that and try and protect Vermonters. And that's why we had to take the steps we did today.
All right, we're going to move to Lisa at the AP.
Thank you, Governor. Do you anticipate bringing the spigot back a little bit more, and at what point would you do that? I know some governors are considering, stay-at-home orders.
Yeah.
So at what point might you consider that?
We'll continue. This is data-driven. It has been since the beginning. And again, as I said before, we've learned a lot over the last 9 months. And so the measures, the steps we're taking today are because of the data that we're seeing. And we're targeting the areas that we see are problematic. And we'll continue to restrict in those areas and trying to be strategic in the way we do it. It's more surgical in some respects. Nothing's off the table. We'll react accordingly based on what we see. And unfortunately, it's not all our doing here in Vermont. We are susceptible to what happens outside our borders, as we're seeing in New York and New Hampshire and Massachusetts and so forth. So, but again, the steps we've taken over the last, even the last week, has been because of what we're seeing, what we're facing, and we'll continue to do that. But we'll see what happens. Again, we meet multiple times a day, and we are really data-driven in this regard.
Okay, and then one other thing. You've talked about the importance, you and Dr. Levine and Vermonters stepping up and doing their part. I just happened to be in 2 stores in Washington County yesterday where the only other people in there were not wearing masks. How do you reach those people who maybe are not paying attention to the news? Is there any other way to get this information out there?
Yeah, I mean, that's difficult, and some are just so reluctant to wearing a mask and doing the right thing. That's why we tell the stories that we do. We try and make sure that people understand how we got into the position we're in today by people being lax, not doing their part, or one individual or 2 or 3, and then it multiplies. In the story that Dr. Levine told, that could have come right out of an epi report. That's what happens. It's not all by someone not doing the right thing, but at the same time, we need to make sure that everyone calls them out, and we're going to tighten the screws over the next couple of weeks. We're going to do everything we can to communicate and make sure the message gets out, and we're counting on all of you, all the media, all those listeners today to send the message, because again, if we are able to put these prevention measures in place now, we'll benefit a month from now. Dr. Levine.
Okay, thank you.
I just wanted to add on to the science on the masks, because that was in the news yesterday. One of the blessings of the administration in Washington not being very active right now on the pandemic is there's not politicization of things like masks that's in the news. But what is in the news, and again, this is a sorry state because it's the CDC again coming a little later to the table, but they're at the table, is that they have basically affirmed something I've been saying for a long time here in Vermont, that the mask is indeed altruistic. It protects the person you're talking to or in the room with from your droplets, but they also say now that it protects the wearer from aerosols and those fine particles that don't just drop to the ground but hang around in the air. So that's important reaffirmation of science with a huge list of references that pretty much says masking is important and masking will protect others and yourself. So I want everybody to have that message once again.
Thank you.
Eric, the Times Argus.
Yes, what are the latest numbers from Rutland Health and Rehab? We heard that there might be 20 residents there and 5 staff who have been tested positive.
Yeah, Secretary Smith, I believe, has those numbers.
This is just, Eric, this is just as I left my office this morning. So we have 19 residents who have tested positive, 5 who are negative, 4 who are hospitalized. Now, those 4 are part of the 19.
And I received a call yesterday from an older Barry resident saying that she had her oil fuel tank inspected and it needs a part replaced. The contractors doing that work are booked up, and the earliest she could get an appointment was the end of December. She said her fuel tank has about a third of a tank left, and she's not going to last that long. She asked her fuel company to drop off some kind of fuel just to get her through, and they said they can't because it's against the law. What is she to do in a situation like this?
Yeah, again, I think Julie might be on the line, Secretary Moore. We do have provisions
I am, Governor.
for getting some fuel to that Vermonter.
Exactly. We are able to make work with individual homeowners and fuel dealers, and can typically make arrangements for a small amount of fuel to be delivered. We understand that there are contractor delays right now in affecting some of these repairs, but encourage whoever reached out to you, they can either contact me or to reach out to our Waste Management and Prevention Division, and there's contact information on the website, and they are happy to work with individuals to develop a site-specific solution. We don't want anyone going cold.
And I think what we can do, Eric, from our end is, I'm sure that we can get another bulletin, a reminder out to the distributors, the fuel oil distributors, making sure they understand that there is a way to accomplish this. So we'll do our part as well. It's a good reminder.
Thank you, Governor.
Colin, 7 days.
Hi, thanks. I don't know who this question is for, but could someone just speak to, in any way, this current spike is different from what we saw in the spring? Are there notable things that are sticking out to you that are markedly different from our first wave?
That's something, Dr. Levine.
I think first off, just looking at the graph I showed, the magnitude. And if you listen to the news every day, you learn that we've surpassed 150,000 cases a day as a country. We've surpassed something in the high 60,000s for hospitalizations as a country. So what we're seeing is we're on the trailing edge in Vermont of that phenomenon, but our data still shows we already have a higher peak than we did in the beginning. So there is all that to contend with. But I don't want it to be looked at all negative, because there's a lot of positive. We've entered this spike with adequate PPE, abundant testing that we're actually expanding even further, and adequate contact tracing, which we're expanding even further to contend with the truly high rise of the number of cases on a daily basis. So the preparedness part and the kind of understanding where this leads is much more clear than it was in that first part of the spike in March. And again, we're being driven by current data, but being driven by current data, we know what the outcome will be if we just sat back and said, numbers aren't going so well, but the whole country's not doing so well, so we're just going to have to go along for the ride. And we're not doing that, because we know from early experience with this virus in that first spike exactly what you will expect and what will happen, and how rapidly things can go out of control in a virus that grows exponentially in the population. So, you have any other things to add? Secretary Smith's going to add a couple.
Colin, that's a great question. We were discussing it earlier this morning. We are much more prepared than we were in March. You've got to remember that there hadn't been a pandemic in 100 years. So when we entered into March, we were building the airplane as we were flying it. In this instance and in this spike, we've got the infrastructure in place. We've got the airplane built. What we have to do is make sure we fly through this turbulence in the best method that we can. And I think some of the steps that we've taken today, in the surgical approach that we've taken today, really show us what we've learned in the past few months.
Thanks for that. And then just to follow up quickly for Dr. Levine, I know our numbers are currently higher, but I also know that we are testing a lot more. Is there any sense that the virus is a lot more prevalent throughout the state right now, that we're not catching it based on the amount we were testing in the spring? Or is there any data on that or anything you could say if you were trying to compare the two spikes?
Yeah, I do think there are differences in the prevalence in the state. And if we use the color analogy, about half of our counties are what we would consider red now, but glass half full, half of our counties are green and yellow. Okay? So your question is really asking, are the green and yellow just being under-tested and we don't really know how much disease is there? But I think our testing is pretty uniform, and though it has been strategic where we pop things up in areas of high activity, we still are testing adequately around the state. And our percent positivity being a little higher, if I could use that as a glass half full as well, the reality is if you're only testing the people who are sick, your numbers are really high. You'll be 10%, 20%, 50% positivity. But if you're testing the people who are really sick, and we know they're presenting, just conversations with the Central Vermont Medical Center Emergency Department, where we have one of the highest levels of activity, people are presenting when they need to present, and they get tested. But we also have a lot of people who are getting tested either for symptoms or for contact that are not testing positive. And so we know that the whole population is kind of being sampled reasonably well. So I feel comfortable with that.
Thanks.
Joe, the Barton Chronicle.
Hello. A reader got in touch with me and said that he had recently learned that both iPhone and Android phones have a built-in app that is intended to facilitate, I think, contact tracing. But both of these require the states that the phone users reside in to have a corresponding app. Vermont doesn't. Is there a reason for that, or is it something that you're contemplating?
Yeah, I think we went over this on Tuesday. Commissioner Pichek is much more articulate than I will be on the subject. I'm not sure if he's on the line, but possibly if you could hold that question, Joe, until Tuesday, we have a better answer because Commissioner Pichek has it. But we're in the early stages, as I recall. It's not, everyone has to agree to it. It's not, it has to be done on a volunteer basis. So it's not something that we're working on right now, but it could be something in the future. I think that's where we somewhat left it. But if you could hold that until Tuesday, or we can have Commissioner Pichek contact you if you'd like.
The letter would be fine if you spoke about it.
Yeah. I'll see if he can do that.
I have one other question, which is you're talking about restaurants for in-person service at 10 p.m. What is the significance of 10 p.m.? I mean, why does that? Why would that have lower transmission rates?
Well, again, I think we're just trying to make sure that we have end date, so to speak, and we're consistent with others. I listened to other governors throughout the last few months, and let's say, I remember Governor Ducey from Arizona, and they imposed some restrictions early on, and they wish they had those in the beginning, and some of them were closing the bars and having a close date or a time that would help them so that it wouldn't last longer. You know, the longer some folks are at a gathering or at a restaurant, let's be honest, the more they might partake in having a few more drinks, and the louder it gets, and the more people are there. So we're just trying to, put some parameters around this, and we think this is a strategic way of doing so.
Thank you very much.
Aaron, VT Digger.
I noted that you said that there's been a rise in the number of individual outbreaks and the number of situations that are affected. What does the health department think its capacity is for contact tracing as the number of not just cases rise, but individual situations rise? Because I imagine that for each one, you kind of have to undergo your own separate contact tracing effort.
Dr. Levine.
Yeah, we've looked at this long and hard, and our original estimate was that the standard contact tracing workforce that we have dedicated to this effort should be able to handle in the range of 90 new cases per day. So we don't do it by situations or outbreaks because we do it by cases. The thing we've learned is that the cases are growing a little faster than anyone would have anticipated. But more importantly, the work of contact tracing, in addition to the case, is connecting with all the contacts. And over the time curve of the pandemic, the number of contacts per case has increased. And so there are a few more contacts per case every time now that have to be factored into the equation of how much work that's going to be for an individual contact tracer. That's why we've activated sort of our reserve contact tracing workforce at the health department and have additional resources coming in from around the state, and people who have somewhat been trained already and others who will need to be newly trained, because we do want to keep up with this demand.
Yeah, so does that also have an effect on not just outbreaks and situations, but also kind of the broader community spread that we're seeing in, say, Washington County, where it's not traceable to any one particular outbreak? I guess what I'm saying is that even more challenging because it doesn't have like a clear connection?
It's not actually, no, it's not any more challenging because there are actually more cases than you would realize where it's impossible to tell where that came from. And that's just the nature of this beast dealing with the SARS-CoV-2 virus, is when it's in a community, sometimes it's very hard to pin your culprit case down. But I want to emphasize the words contact tracing, they're really not designed around tracing back to where the virus came, though that's a core function. The contact tracing is really making sure that other people who are traced back to the person you already know is a case can be quarantined so that they will not endanger the health of anyone else around them. So you can snuff things out right there because the pathways of infection are being stopped to the best of your knowledge, because anyone who was in contact with the case that you're doing the contact tracing on has been identified and appropriate guidance has been provided.
Yeah, I remember the Department of Health put out a report a couple months ago on known versus unknown sources of exposure. I'd be interested to see an update to that sometime in the future. But anyway, that's all for me. Thank you.
Liz, the Burlington Free Press.
Hi, thank you. I have two questions. The first is for the governor. I know, Governor, that you said that you're hoping that Vermonters will do the right thing and follow these new guidelines or new rules very closely. I'm wondering, now that you've banned multiple house gatherings, if there are any consequences for outbreaks after the ban that can be traced back to a multi-house gathering.
Well, certainly, I'm not sure what the question is, but the contact tracing, hopefully people would be forthright and honest about when someone from the state, from the EPI team contacts them, that won't leave any details out, because if they do, it'll have a detrimental effect on someone's at some point, and the ripple effect, as Dr. Levine talked about in his story, is dramatic. So first of all, just make sure you answer truthfully, honestly, forthright, and don't leave those details out, because that's important. We don't have an enforcement mechanism, if that's what you're asking, but again, we're not, I don't believe we're at that point. What we need to do is just make sure people do the right thing and give us all the information we need, because again, just that one little piece of information that you might have left out could slow everything down and could lead to an outbreak somewhere else, a week or two down the road. So it spreads so quick. So just be honest. I'm sure they'll do it. I'm sure that they will do the right thing, because again, it could affect their family, their friends, their neighbors, and all across Vermont.
Great. Yeah, and just to clarify, it was kind of pointing to the enforcement mechanism, but kind of after a contact tracer has traced back to multi-house gatherings that happened after you banned them, if there's any enforcement there.
Yeah, again, there could be in the future. We haven't contemplated that at this point in time. I might ask maybe Commissioner Sherling if he wants to weigh in on any of this at this point.
Thanks, Governor. Really not much more to add than that.
Okay. Well, again, if we see multiple violations, obviously we'll do what we can to make sure there's guidance and education that's involved, and we can always resort to something more stringent in the future. But right now, it's really about getting that information, because we have to stay ahead of this. That's the point. And if we, if there's
Governor?
Yes, go ahead.
I'm sorry. It does strike me it's an opportunity to reemphasize that we are starting today going out and doing compliance assessments at a variety of businesses, and I think the future posture will be informed by what we find over the next several days as we do that. We're certainly hopeful, again, that we'll find broad compliance, especially in the wake of the experience that Vermont is having right now.
Thank you. My second question has to do with urging Vermonters to give complete information to contact tracers. Has that not been happening?
Again, from my standpoint, and I don't have any direct knowledge other than anecdotal, and I know people who have been contacted who haven't given all the exact information or have left something out. So I think it's happening. I don't know if we can point to anything in particular, but I might ask Secretary Smith to comment further.
Obviously, through the last 8 or 9 months, we've had instances where people have not been cooperative, have not provided us the right information, or in some cases the wrong information. The most recent cases is we had a Halloween event where people were not answering the phone, and and not getting back to the contact tracers, and in some cases, not providing info that was fully truthful, to be honest. So I think, the executive order mentions that to please, when the health department calls, answer the phone, provide information that's truthful, and as the governor said, is as much information as you can give to that contact tracer, and then comply with the recommendations from the health department, in particular when they ask you to quarantine. So these are, this is built on things that we've experienced over the several months, but we've seen it just recently with some of the Halloween parties.
Thank you.
Ed, Newport Daily Express. Ed?
I'm gonna switch bases a little. You, of course, somewhat recently announced funding that goes toward building a new courthouse in downtown Newport. Could you give a little comment about that, and also give us an idea of what kind of timing you anticipate from starting the process when the building will be completed? And the third thing is, can you please make a comment on a commitment to make sure that the old building doesn't just sit there empty and rot, that there's actually going to be a plan for its future use?
Yeah, we have a whole plan in place. Obviously, we're looking for any types of interest in providing for that space. But maybe what we can do, Ed, is I can have somebody from BGS get in touch with you directly, Buildings and General Services, or maybe Secretary Young, just so we can go through the process with you. I don't have everything, all the details here, and it'd be unfair to mislead you in any way. So talking about some of the COVID-related items today, I'd like to stick to that if I could.
Okay, that's fine.
I'll have somebody get a hold of you.
Okay, thank you.
Hadley, the Valley Reporter.
Hi, Governor. My first question is related to contact tracing and the fact that many people aren't answering contact tracing calls because they come from unknown numbers. So do contact tracers call from Vermont area codes only? And would you recommend that people pick up the phone if they receive an unknown call from an 802 number?
Yeah, good question. Dr. Levine.
Yeah, with the enhanced volume of all the cases and the need for multiple people on the phone all the time, they no longer come from one 802 number that is more identifiable as the health department. So they all come from 802 numbers, but you may not recognize the number.
They'll leave a message.
And most of the time, they will leave a message. It won't be a very specific message, but it'll let you know that it's the health department. So please pick up the message if you don't pick up the phone.
Thank you. And my next question is for Dan French, and it's about the state's current music education guidelines, which don't allow students to sing or play instruments together inside, even while socially distanced with masks on. So for a little bit of context, I spoke with a local music educator who happens to sit on the council of the National Association for Music Education, and she said she was appalled at the hypocrisy in state guidelines which let students practice sports indoors for hours at a time, while those same students can't take this curricular music class for credit indoors if it involves singing or playing instruments together. And she was also upset to see that no one from the arts was actually involved in writing the state guidance on music. So my question is, will the state revisit music education guidelines or consider giving music educators a seat at the table when it comes to writing those guidelines?
Yeah, hi, Secretary French, thank you. Yeah, I mean, music has been very challenging for us. To your point about hypocrisy, we do look at each activity separately, so it's not like if we found a path forward with one activity, we would automatically allow another activity. And there's been quite a bit of research on music that makes it really challenging to provide accommodations at school, and we've been struggling with that with our team, and with music educators all summer long. Most recently, we reached out, the Music Association educators reached out to us as well, and we're meeting. We formed a little work group to see what we can do, but it's a very challenging area for us to find a way to do it.
All right, thank you.
Kat, WCAS?
Hi, this question is for Dr. Levine, and likely in a kind of a similar vein to a question that was asked earlier, but I'm curious whether we actually have more COVID-19 virus in our communities right now versus when we did earlier in the pandemic. Because as you talked about earlier, we do have more testing capacity right now to catch cases that are out there. But do we actually think that there is more cases we're catching and the virus load is actually lower right now, or do we have more virus now and we're getting better at catching it?
Can always count on you for a challenging question, Kat. This one doesn't have a straightforward answer, but I can give you my best guesstimate of the answer. There clearly is more virus prevalent in our communities. A lot of that related to the fact that, as we've said many times, it's been encroaching on our state, both nationally and more recently regionally, for a while. So more virus has entered the state. However, I wouldn't want people to mistake that for we never had the virus in the state. The virus has been here since March. It hasn't gone anywhere. It's waiting to do its thing. It's always been here. And now that the weather got colder, even before the recent warm snap, the weather got colder, people are more indoors, and there were more gatherings, and as the governor's calendar told him, the dates were right for Halloween parties. People are in the time frame that is much more opportunistic for them to be able to give the virus to somebody else. So part of it is more came into the state, but there was always a bunch of it in the state. It's still here, and it's now no longer summer. People are indoors giving it to each other because the conditions are right for that to happen.
Okay, so you don't think then that it was, we had exactly this much virus in the community earlier in the pandemic and we just didn't have the testing capacity to catch it all?
No, I think that in the very, very early, March, April, yes. That was a definite problem that, was not our problem. It was a national problem and a crisis. But since the late spring, through the summer, up until a month or two ago, testing was always on our radar. Testing was being done really frequently. It spiked even higher with the college students, but the fact is we still had a lot of testing of non-college student Vermonters. So it's not because of testing that we're seeing more cases now. And I think, based on what I'm hearing about emergency rooms and things, that we're starting to see more people who have symptoms leading to them getting tested, not just people who might need to be tested to get out of quarantine or because they've been in contact with someone. And I think what we ask people to do, which is if you've been to a social gathering, but we don't care how you feel, you should get yourself tested because you put yourself in a higher risk situation. So I think we're seeing the impact of that as well. So very multifactorial, but the fact of the matter is there's more virus around, and the virus that was always around is getting transmitted person to person.
Thank you. I appreciate adding the context to kind of some of the numbers that we report where we go, well, we hit a record number of cases. And well, what does that mean? And how does that compare to earlier in the pandemic? So I appreciate that. My second question is because I know we're going to get this one in an email from people today. They're going to say, these new rules are punishing people who were already following the rules, and the people who weren't listening to you to begin with aren't going to listen to you now just because there's a mandate. Do you feel, though, that this mandate will actually get the message across to people?
Oh, we certainly hope so. We're going to count on peer pressure as well. And the more we get this information out, the more we articulate what the problem is, I think the quicker we solve it. And it's going to take each and every one of us to do that, but we're going to have to educate each other as well. Again, when I said I don't take this lightly, shutting down businesses isn't something that I look forward to doing. Taking away youth sports is not something that I look forward to doing. But I think it's necessary at this point in time. And again, the quicker we comply, the quicker we get this under control, the quicker we can get back to what we experienced before.
Thank you, I appreciate it.
Courtney, Local 22.
Hi, my question is what your reaction is to a number of large businesses, companies with essential employees opting not to apply to the state hazard pay grant program that would impact thousands of Vermont frontline workers.
Yeah, obviously, we're urging them to apply so that their employees can benefit. I did have some correspondence with Walmart in particular, sent them a letter, and I think some of our administration has heard back from them. But we've seen this week where other larger entities have said that they are going to take a second look. They didn't think it applied to them, and we're trying to make sure they have all the information needed so that they can take advantage of this for their employees, not for themselves, but for the employees. So we're still working this through. We've extended the date as well as there's money available so that we want them to take advantage of this.
Thank you.
All right, just a quick time check here. It's 12:22. We're about 50 minutes into the questions, and we are just over halfway through the queue. Mike Donahue, the Islander.
Thanks, Rebecca. Governor, first, just a quick point of clarification. Does the halt of recreational sports mean that commercial bowling alleys need to shut down? And is this order an extension of your state of emergency order?
Yeah, two parts to that. I believe it does affect bowling alleys. And it is part of the executive order.
But that was due to expire, isn't it, tomorrow or something?
Yeah, I think it's Sunday, or maybe it's tomorrow, but I think it's this weekend. So this is an extension of the executive order that I'll sign today.
Okay. And for Dr. Levine, wanted to ask about COVID fatigue. We received several inquiries, and I know other reporters and editors were baffled at the end of the last news conference when the last questioner asked about an unpublicized outbreak at a Rutland senior facility. There were 7 or 8 seniors and a staff member, I think, at the time. And I was just wondering why, was it COVID fatigue for not disclosing that outbreak, unlike what the state did earlier with the Burlington facilities, or was it a planned decision by the state not to inform Vermonters about the Rutland outbreak?
Certainly was none of the above. As I've kind of pointed out today, there are so many outbreaks, so many situations, and they're developing moment to moment. We couldn't possibly stand here and go through them all. And we have no interest in not being transparent about the Rutland outbreak, and Secretary Smith just presented the numbers on it again today when he got questioned about it. And we obviously consider it quite significant, and watching it very closely and providing as much support as we can. The Health Outbreak Prevention Response Team has been doing everything it always does in such situations. And we always check with these facilities about PPE adequacy at the time. Nothing in the area of not being transparent. And certainly pandemic fatigue is not accounting for anything we do or don't say to people. Just we can only provide so much information at a given press conference. I think Secretary Smith wants to add to that.
But could I just ask you a clarification? Last Tuesday, the large uptick and everything like that had not happened. And after 2+ hours and all the charts and graphs and everything, it wasn't disclosed. So should we be asking for the top 5 outbreaks each day? Maybe you can't give us all, but at least ask for the top 5.
Hey, Mike, this is Mike Smith. I did disclose it on last Tuesday. I talked about the number of people that were affected at the time. I can't remember what numbers I used during that period, but I gave the numbers of both positives at that facility and of residents and of staff. And I believe I actually mentioned the hospitalizations as well.
No, you were forthcoming once the question was asked, no question about it. But it was the last questioner of the day, more than 2 hours in the press conference before. It was an ask for a confirmation, and you were kind enough to confirm and give the numbers. But what I'm getting at is there was no disclosure early on.
Yeah, it was a breaking situation at the time. I wanted to make sure that we had all the numbers, and it was happening as we were at the press conference that I was getting these numbers.
Great. Okay, thank you all very much.
Liam, VPR?
Hi, I had a question just kind of clarifying a little bit about the ban on multiple household social gatherings. Just trying to get a sense for people, what that actually looks like. I mean, should they be thinking about this as sort of similar to the way the stay-at-home order was structured, where people are really just supposed to, hunker down and stay in their places where they live and not interact with anyone else? I guess it's a little different now since people could still theoretically go out to a restaurant, I guess, or go to school. And I'm just trying to clarify a little bit of what this should look like and how people should be behaving, since people might have some questions about whether they can go for a walk with somebody or see the people in the trusted household that they have been potting with during this time.
Yeah, this is obviously different than the beginning. This is not stay home, stay safe. This is make sure, this is really about socially isolating, separating in some respects. So unless it's in your current household, you shouldn't interact with anyone. You shouldn't interact with your neighbor. You shouldn't get together for horseshoes or having a beer or coffee or anything like that. You need to stay away from each other. So this is exactly the predicament we're in at this point. You can go out for a walk, but you can't go out for a walk with your neighbor, if that makes sense. So this is different than stay home, stay safe, because you can still go out. You can get your groceries, you can do everything that you need to do, but you can't interact socially with others around you that you aren't connected with within your household as of that moment, if that makes sense.
It does. I mean, I think it kind of raises some questions of, if a gym is still open, if our restaurants are still open. I mean, if these are activities that inherently involve some degree of social interaction, even if you're just going with, say, like, you're someone that you're in your own household with. I know in the past you and Dr. Levine have said just because something is allowed doesn't mean you should do it. So I'm just sort of wondering what your message to Vermonters is if you're going to kind of continue to allow some activities, but say not to do other things.
Yeah, we want everyone to just be careful. Those are structured environments, whether it's a gym or whether it's a restaurant. There are guidelines in place there. There isn't much for the interactions with your neighbor. So I would want to, and I'll ask Dr. Levine to add to this, but if it were me, I would ask myself, some of the questions that you're asked when you go to the dentist or something else. They ask you whether you've been sick, whether you've been in contact with anyone else who's been sick, have you been on public transportation. Ask these questions of anyone you come in contact with, and are you willing, for that half hour of interaction with another person, someone, maybe a neighbor or a friend that you don't know where they've been. Are you willing to quarantine for 14 days as a result of having that interaction with them? Ask yourself, are you willing to sacrifice that? Because you could be getting a call the very next day because that person was in contact with a positive case. So it's just that simple. Dr. Levine?
Yeah, I mean, the bottom line is nobody knows who's got what, who harbors virus, who doesn't harbor virus, who's in a pre-symptomatic infectious stage, who's not. But everything is laid out very clearly, as the governor said. When you go to a restaurant, it's as a household, not as multiple households. When you go to the gym, there's very clear guidance to the gyms about how to distance people, and it's not a social experience, it's an individual exercise experience. When you go to work, you don't have coffee breaks, like in my story, with everybody who you work with. If you all have a reason to be there and you need to be there in person at work, you do your job, but you don't necessarily create the situations where you'll expose yourself to each other. Those are kind of the things we're telling people right now. So it doesn't mean stay home by any means. We have noticed, just on another topic, that there are times that people are teleworking, which is fine, and we recommend that. But then when they need to have a larger meeting of getting everybody together, they choose to not do it online, but they choose to do it in a conference room. That's probably not the behavior that we're recommending at this point in time. That's really going to be conducive to worksite transmission of virus. So we would encourage that environment to be on Zoom or some other platform and not in person. So it takes a great deal of, unfortunate thinking about what you're doing every day, which I think will become very natural, but at the same time, we're recommending that you try to live your lives in as full a way as possible, but without that dimension of that socialization and getting together with those who aren't in your household.
Thank you.
Greg, the county courier?
Hi, Governor. Just a quick clarification to start with the order that was released today. Am I under the understanding that on the eve of rifle season, those who are attending a deer camp with maybe two families that split a deer camp, that will be restricted?
Yeah, technically it would. So when someone is going to deer camp now and they're going to be interconnected with others from another household, be prepared to quarantine when you get home.
Okay. And we're hearing from some employers that are having trouble submitting their application for the hazard pay program. That deadline is today. If employers are having trouble getting through and have been having trouble most of the week getting through, will the state work with them into next week? Or if they don't get through by the end of the day today, are they done?
I believe there's an extension in place, but maybe I can have Commissioner Pichek reach out to you, or maybe Secretary Curley has that information.
On the hazard pay?
Yes.
Yeah, I do not. I think that Commissioner Pichek would be better to ask about that.
I'll have Commissioner Pichek get in touch with you, Greg.
Okay. And lastly, when it comes to setting public policy, the World Health Organization sets the value of the human life at $10 million. With the $1.25 billion that Vermont received, that means that Vermont should have saved at least 125 Vermonters' lives. Do you believe that we saved at least that many to date? And when as you're moving forward,
what kind of value do you set on human life when you decide to restrict or not restrict sectors of the economy?
I would say we don't put a value like that, not a numerical value on someone's life. It's like priceless. So every life is important from my perspective. And so we don't look at it in those terms. I will say that I believe Vermont's done fairly well. We have the lowest number of deaths in the U.S. We have M per capita. So we've done fairly well in that regard. But again, we've lost 59 lives have been lost due to the pandemic, and that's not something I take lightly.
So, I mean, if every life was priceless, the entire economy would be shut down. So I'm just trying to get back.
Yeah, I'm not. What I'm saying is, I can't put a dollar figure on that. I'm not going to put a dollar figure on that, if that's what you're getting at.
Okay, I think that's it. Thank you.
Avery, WCAX.
Governor, you've mentioned taking this week by week. So with these new restrictions, what is your advice to Vermonters for Thanksgiving? Not to travel, obviously, but for just like in Vermont. Do you just recommend they do it in their immediate household, just with them?
Yes. Yeah, that's what I'm saying. I know this is going to be unusual. This is going to be difficult. This is something that most of us have not experienced. We want to see our families. Again, with my own mom, I haven't seen her physically for a year. I have a daughter who lives in Rhode Island. I haven't seen her since this pandemic started, probably almost a year as well. So this is difficult on all of us, but it's really important that you don't have Thanksgiving dinner with friends and family that are not part of the household you currently have today. Because it's just that important. Maybe put it off. Maybe we can have Thanksgiving at another time with the rest of the family when we get this under control, but it's not right now. We're at a critical time here in Vermont, and asking you, Vermonters, to sacrifice one more time. Don't get together as a family or with friends outside of the normal household.
And a quick question for Dr. Levine. Has the UVM cyber attack had an impact on test results getting back to people getting tested for COVID?
The question was, does the cyber attack have an impact on test results getting back timely? So yes, the answer is yes, we are aware of cases that pertains to. However, I believe at the Tuesday press conference, Secretary Smith talked about the numbers of fax machines in the teens, I believe. So again, because they've had to resort to paper and more outdated technology, I'll use that word, they've been able to become effective with using that as a surrogate for their usual information systems and are now caught up with the backlog of what they had previously. So I think that's an important point. So my hope is I won't be hearing into the future that people still find that the results aren't getting back to them in a timely way. But one caveat there is that some of the results have been sent to, not some of the results, some of the specimens have been sent to a lab that has had a longer than expected turnaround time out of state, which we have no control over, but we've tried to divert those specimens from going there in the future if they can go to other places with a faster turnaround time. I also want to just reinforce one other point that came up in your first question, because I don't want to set unrealistic expectations. While I would love to see our cases get back to 20 cases in the next 5 to 7 days because we've done this, we know that that is not scientifically valid reasoning. One has to realize that the cases will continue to go up just because of people getting infected as we speak, even before the implementation of the plans you've heard about today. So one needs to give several weeks time duration to go by to begin to see the kind of impact that you'd want to see. But I do want to remind people that we did see that back in March and April. And so, again, setting your expectations realistically, but not feeling that, oh, Thanksgiving will come and this will have accomplished its task so we can then back off, because that's not enough days gone by yet when you think that this is the 13th of November. Thank you.
Thank you.
Who would have thought fax machines would make a comeback? Drive-ins. Don't throw those 8-tracks away either.
Peter, VTR?
Governor, when you answered the question about deer camp, you said if people are going to do that, they're going to go to deer camp with people outside their household, they need to be prepared to quarantine if they do. Is that allowable behavior under this order that you've issued?
Again, unfortunately, Peter, some are heading out or there right now. I mean, deer season starts on Sunday. When I used to go to deer camp, I might leave on Thursday. So I would anticipate many of them have already gone, are not going to get this information before, well, actually, this goes into effect at 10 p.m. on Saturday. So, it's just, we have to be practical about this. Not everybody's going to hear this, but if they're listening to it right now and they want to prevent a quarantine period or another test, 7 days and a test, they should rethink going to deer camp with this group of people outside of their households.
So is it an option for people to get together with people outside their household?
Again, this is not perfect, Peter. This is something, again, that's breaking today, and for someone who's already there, or is not going to hear this until next week sometime. I'm just saying, no, this isn't preferable. I don't want people to get together with their family and friends from outside their household. That's not the message, and I think we should be very clear about that. That's not what we're trying to do here. We're trying to get people to prevent this from happening, prevent the spread from getting together in the first place. But if they do, for whatever reason, and I would say we're in a transition period, especially this weekend, be prepared to quarantine when you come back.
And Commissioner Levine, the modeling that was issued as recently as Tuesday did not forecast the spike that we've seen. Has that at all called into question the effectiveness of the formula you're using, and are you revisiting the variables that go into that forecast, given the fact that it did not predict what we're seeing right now?
I'm going to let Commissioner Pichak answer most of that on Tuesday, but I will say the modeling has predicted the increases. I think what you're referring to is maybe the magnitude of the increase, especially on the day that we had over 100, which you're right. We need to see how these trends play out and where they settle out. If they're going to be consistently over 100 or less, it's hard to know. But the fact is, the modeling has been accurate in telling us this month and next month and into the winter are going to be much different than what we've had in the summer. And we've been gearing up and trying to adhere to that guidance all along.
Thank you.
Tim, Vermont Business Magazine?
Hi, Governor, just be clear, bowling alleys are still open, you just can't go with anybody but someone in your household, and gyms the same way. I searched the executive order, I didn't see anything specific to that.
Maybe Commissioner Sherling or Secretary Curley could answer this.
Yeah, I can help, Governor. Yes, we, bowling alleys would continue to fall under what we refer to as Section 8.1. We have not hit pause on that. Rather, it's the section that talks about sports, organized sports, league play. So yes, if you were going to a bowling alley with members of your same household, you could do that. But we have paused league play at this point.
Okay, and as far as the Thank you for that. And as far as the 75 million, could that change, Governor, if all of a sudden you had to open up all these surge sites? Would you have to redirect that money, or is that money already set aside for the surge sites?
No, I think we're we're all set in terms of the surge sites, but we know that what businesses are facing today, they need the money, and we need to disperse it before the end of December. So I think we're okay. We're in good shape, at least for the near future. But we're going to need Congress to act to help both economically and from a health standpoint in the very near future, after the first of the year.
And that, sure. And as for the hazard pay, a lot of people are wondering, well, why don't these big companies just do this? What's the holdup on their side? It sounds like what you're saying is that they didn't realize they could be. Is that the case with Walmart?
I think there's a multitude of reasons, Tim, and I don't know all of them. Probably better if you called them and asked them their reasoning. But from what I've heard, again, some didn't think that they qualified because they were a large corporation, just didn't understand the program. So they needed some education there. Others wanted to, I think they were thinking they were being altruistic because they thought that there were other smaller companies that were more impacted than they were, and they'd done a lot for their own employees, so they didn't feel as though they just wanted the money to go to others in greater need. But again, this isn't about the companies, it's about the employees. So we are advocating, asking them to come to the aid of their employees. This money's available. We have some that we've extended the date. We have some that more money available now. And we just want them to apply on behalf of their employees.
All right, great. Thank you for all that.
Ann Wallace-Allen, VT Digger.
Hi, can you hear me?
We can.
Hi, Governor. So I'm curious about these restrictions on social behavior. How does not going for a walk with my neighbor square with my ability to continue eating in a restaurant?
Yeah, I think we just went through that, Ann. I mean, the restaurants are more structured. We're not saying you can go to a restaurant with your neighbor. We're saying you can go to the restaurant with your family, your immediate family, your household members, and there are guidelines in place once you get there. So much different than you going out with your neighbor for an hour or two walk side by side, where you don't know what your neighbor has done. So again, you might know more about what your own family has done than you do your neighbor. Does that make sense?
Right, but it does, but the people at the next table, I don't know what they've done.
Right, but you're not within, you're supposed to be 6 feet apart from them. You're not walking side by side with them for any extended period of time.
Okay, what about ski areas? Do you expect any change in the rules for how ski areas operate and attract people up from other states?
Yeah, well, again, the
And
travel
their
policy,
activities?
the travel policy in itself is going to restrict many at this point, right, today. But thankfully, in some respects, we don't have any snow today. We're going to have to monitor the situation. I can't predict where we're going to be in another month and a half, but my hope is that if we take the steps we're talking about today, that we mitigate the spread of the virus, that we'll work our way through this over the next month and a half, and that there will be brighter days ahead. And maybe at that point, things will look much better, and we can have the conversation about ski areas at that point.
Is there also a possibility that you might end up making some other decisions, like with salons or gyms, which are also businesses that you closed in March?
Yeah, again, we've learned a lot about the virus and where it's spreading. That's why I said this is really based on, this is data-driven. And we looked strategically at where are we seeing the outbreaks today? What is it that we're seeing that was the root of the cause, so to speak? And that's why we're taking the steps we are today to have a positive impact on the spread, so that it doesn't spread any further. So obviously all of those are on the table. But at this point in time, we're just not seeing the spread as a result of some of the hair salons and barbershops. That's not where it's happening.
And what about gyms?
We're not seeing it to any great extent there either. Anything that we've seen thus far, I believe, has been the result of somebody bringing it in from another outbreak, but they've shut down and taken care of it. So we're not seeing the spread there either.
I think Commissioner Sherling has one more point to add on restaurants.
Just one more quick question. Is there anything that the state could have done differently so that we wouldn't end up in this at this point?
Well, again, playing Monday morning quarterback, it's pretty easy to go back and maybe see something, but I can't, nothing comes to mind. We've been reacting accordingly all along the way. The rise in cases has come quickly. And when you see New Hampshire, for instance, had over 300 cases yesterday. And we had averaging 25 cases last week. So we tried to do what we could in terms of Halloween parties. I'm sure you reported it, maybe in your, at VT Digger, maybe you had a story about not participating in Halloween parties and so forth. We were very specific about that about 2 or 3 weeks ago. Unfortunately, not everybody either read your article or heard us. So as a result of that, we saw an outbreak. So again, it's people letting their guard down, not adhering to some of the guidance that we're putting forward, and now we're experiencing the results of that. So again, if you can help us out, get the message out, kind of suck it up for a while, dig deep, we'll get through this. But we're asking you to socially separate at this point, not just physically separate, socially separate, to get through this latest uptick. Commissioner Sherling wanted to add something to the restaurant guidance, I believe.
Yeah, thanks, Governor. I think you covered a piece of it there at the end, but I was just going to add that the data does not show that if you go as a single household to a restaurant that there's a risk as long as that restaurant's following the rest of the guidance. And I would add as an addendum to the answer on anything that could have been done differently. I think what we saw was a pivot from large, wide-scale compliance with guidance to unfortunately some hesitancy and some missteps. So if the guidance had been adhered to, our numbers would not look like this right now.
Is there any possibility, especially with things like the contact tracers, since it's been acknowledged that people don't seem to always cooperate with those, is there any possibility of penalties to bring people into compliance with this guidance?
If that's for me, again, we're just beginning a short duration process to do compliance assessments, but as the governor's indicated, nothing's off the table depending on what our evolving experience looks like.
Okay, thanks so much.
Guy Page, Chronicle of the Vermont State House.
Governor, do the new restrictions apply to this weekend's scheduled religious services?
No, it doesn't.
Okay, good to hear. A question perhaps for the doctor. Are these new restrictions at all prompted by your concern about hospitals' reduced efficiency due to having to cope with the cyber attack? Is there a connection there?
Yeah, thanks for that question. The answer is absolutely not. The hospital is functioning very efficiently, as much as they can. All the hospitals in that system are continuing to deliver quality care to people. It's our concern about hospitals in general, just like we had in March, not letting the number of cases get so high that the capacity of the healthcare system itself is challenged. But again, we laid out today our 3 priorities. Keep people at work, keep kids in school, and keep people safe from severe illness, so reducing the number of hospitalizations and the number of deaths potentially by reducing the number of cases through human behavior change. Those are all priorities that I would dare say they stand on equal footing. It's not that we were concerned that one healthcare system had challenges due to a cyber attack and we had to do all this. Nothing could be farther from the truth, and it wasn't even mentioned in all of our deliberations over many days.
Thank you.
Olivia, WCAX.
Hello, I have a question for Dr. Levine and Secretary French. So obviously there are more outbreaks, people are being told not to gather and quarantine if they go out of state, but it seems many people think if they visit extended family for the holidays, be it in-state or out of state, that they're safe because it's just their family. So will there be a mandate for schools to move to a remote method after Thanksgiving, either for a few weeks or even through the winter holidays, just as a precaution?
This is Secretary French. No, currently we are not planning such a preemptive decision, but we'll certainly monitor the trends and the data, but we don't think a preemptive decision like that's in the best interest of students right now.
But would it make it easier for teachers? That way they can plan remote classes and not have to balance both those learning remotely and in person?
Well, I think it's, the theme of the press conference today, we're hoping and expecting that educators in particular will follow the travel guidance and not travel out of state, precisely so we can protect the opportunities for in-person instruction.
Okay. And then also, in the beginning of the press conference, Governor Scott said that schools can stay open, but meetings that can be held virtually should be done that way. So I guess the big question is, what will it take to move back into a remote phase for schools?
Yeah, I mean, the issue of meetings is something we've been encouraging all along, but it's something that needs to be emphasized now more so than ever. We probably haven't been as strong in our messaging. There's a lot of meetings that occur as a part of administering schools, particularly as people have been back inside their buildings. We just want to make sure that even when they're in the buildings that they're taking advantage of any remote technology to hold administrative meetings. But the issue with remote, we're looking at the broader indicators that are going on. I think, to make the point, the lesson we've learned from the spring, per se, is that we're going after sort of the root cause of this, which is the group gatherings right now. Everything we're seeing indicates that schools are operating very safely. So as long as we can continue to do that, we're going to seek to protect that and then try to, on a sort of a surgical basis, go after the cause of the increase in cases.
All right. Thank you.
Greg, the Bennington Banner. Greg, the Bennington Banner. Okay, we'll move to Austin, the Burlington Free Press.
Hi there. Thanks for sticking this out with us so deep into today's session. I think my first question is for Governor Scott or Dr. Levine, and I know there's some families out there that have formed pods for either remote teaching purposes to share resources, and I was hoping you could educate folks, maybe explain if you differentiate between a pod and a household and why. Like, if these families have created a pod, do they now have to break up that pod because they live in different physical homes?
I'm not as familiar with what a pod represents. Dr. Levine might be able to answer that.
A pod goes along the theme of a trusted household. And I would dare say that it's hard to be a trusted household in an environment where the virus is more prevalent in your community. It has nothing to do with being the best of friends, being the people you would trust with your life at any other time your existence. It just has to do with the reality of the virus prevalence in our communities. So that makes it very, very challenging. I do understand the concept, but even podded households, they're restricting their social interactions in other ways. I understand that, but they still have other lives that they live apart from the household that they're podded with, whether that's in their own work life, in their spouse's work life, in their kids' work life, etc. So it's very, very challenging to recreate that at this kind of time. Just the reality of the data that we have.
Okay, and I guess the second question here is a little less direct, and I've been trying to work through some things mentally, but the restrictions of the last week that you guys have unveiled have left me wondering, like, what specifically about the until now acceptable protocols, like maintaining distance, masking, staying outside, are suddenly, less effective in tamping down transmission of the virus. Like, if you're to walk along a road, with a friend or a parent on opposite sides of a dirt road, one of the back roads, a nice fall walk, how is that suddenly less, effective at avoiding transmission?
Yeah, no, I get where you're coming from. The whole thesis for what we're talking about, though, is there are certain environments that are more structured, and we've talked about those through the last several questions, but the small gatherings of people tend to be unstructured, tend to not follow any specific guidance, go beyond distancing and masking because they're usually in circumstances of food and drink, and that does not allow people to abide by the kind of guidance they might abide by in any other circumstance in their life. And these are prevalent enough that they're worthy of comment today and policy changes that you've heard. It's as simple as that. And though I didn't want to recite the 100 plus outbreaks and situations we're dealing with, every single one of them resonates around that theme for the most part, 70+%. So we're just doing what we need to do based on what we know. But to carry your question further, I do not want Vermonters saying, I guess this means I don't need to wear a mask or stay distanced from someone because it didn't work. That's far from true. It's very effective, it works, but when your inhibitions are down or your social circumstances mandate avoiding those pieces of guidance because you're eating and drinking with others, that's when things happen. That's all I can say.
Is it fair to consider this perhaps like if folks can be comfortable with their actions as strict as they can take them? Like, I mean, if you're going to stay 10 to 12, 15 feet away from someone that you need to talk to, want to see in some form, and you're going to stay masked, and you're strict with that with yourself, I mean, can you be confident in doing that?
I think that's just taking our usual guidance and being confident that the usual guidance will hold you in good stead. So I would say yes. You're taking your solo walk and you may encounter another person. And you'll clearly want to be on the opposite side of the street and having your mask on at that time too. Just like if you were on a trail climbing a mountain and somebody was coming down, you would have to react to that. So again, do all of the things you always have done, but in addition, the crowds and here the small gatherings are what we're talking about. That's completely got to be considered every time you act.
Thank you so much.
All right, we have one questioner, Steve from NEK TV, but it is 1:04, Steve, so please keep it short.
Hello.
Go ahead, Steve.
Hello, can you hear me?
We can.
Yeah, I was wondering about keeping it short, and I see that one outlet had four questioners, four others had 2 questioners, but I guess that's neither here nor there. Governor, one for the governor and one for the doctor, if I may. Governor, on your executive order about the new policing stuff, you said that you actively engage with communities, particularly those communities that have been historically marginalized or harmed by policing, as we develop and deploy the best policing practices. As you know, since 1937, marijuana and hashish were wrongly classified as a narcotic. And, every August, our state police would gleefully go up with the National Guard and helicopters and arrest people for growing outdoors. And I've seen people who now have police records for having stuff as simple as, an empty pipe. Are these people considered marginalized, and will they be included in this new panel and get input?
Yeah, I have no idea, Steve.
Well, would you consider them to be marginalized or harmed by these policing practices?
Maybe of the last few decades before any current times, but I just don't, I wouldn't even know how to answer that.
If I may, Governor, it's an opportunity to say that all Vermonters of all communities are certainly encouraged to participate in this process. If you go to our website, bps.vermont.gov/modernization, you can review some existing drafts of new work, and there are feedback tools available to all Vermonters there.
Oh, thanks, Commissioner Sherling. It's very reassuring. I'm glad to hear it. Would you consider these people to be marginalized or harmed by former policing practices?
I don't exactly know how to answer that question. I'd need to contemplate a little further and know a little bit more.
Steve, could we move to, do you say you had a question for Dr. Levine?
Yes, Dr. Levine, we keep referring to the PCR method as a test, and I've been reading up on the inventor of this method, Dr. Terry Banks Mullis, and from what I can see, he was actually quoted as saying that it's not to be used as a diagnostic tool, and that PCR was expressly not approved for diagnostic purposes, and it says so on the leaflets, and it's simply incapable of diagnosing any disease, and it does not mean that an infection is present. Isn't the PCR method more of an amplification method rather than a testing procedure?
Yeah, so without getting too into the weeds with regard to how we assay a specimen from somebody's nasal passages, there are several steps that have to occur. There's a amplification, well, first of all, there's an extraction process. The extraction process extracts the viral nucleic acid. The second part is the amplification, which is so you can try to measure that in the assay that you're performing. So it's a two-part affair, if you will. The simplest answer to your question, so people don't come away too confused, is that the procedure is used to be exquisitely sensitive at finding particles of the virus's nucleic acid, the viral RNA. So it does just that, and the person you noted, wonderful invention, wonderful methodology. The intent of the comments that you were quoting, I believe, is consonant with what I've said at other times, which is just because you detect something doesn't mean that person is actively infected. And the way we've learned that is in this pandemic, there are people who get tested, are symptomatic, have an infection, resolve the infection, and you go back 3 months later and test them again, and they're positive. And it causes all kinds of trouble in their lives and in everybody else's lives as to what does that mean. And what the scientific community believes now is that means that there's still some residual viral RNA that's detectable in that person. Probably fragments, almost certainly not viable in terms of being able to infect someone. So for us to call that person infected with COVID-19 would be a problem. So that's what you're driving at, is not every time you find the virus, are you finding a person who's actively infected. But the flip side of that is there are people who have no symptoms, who have a very high load of virus, and we would hate to use that logic on them because those people are acutely infected and capable of infecting others, even though they don't have any symptoms at the time. So it has to do with how do we define a disease and all the clinical circumstances surrounding it, and then integrate what the test showed into our decision making. So let's leave it at that so we won't complicate life for everybody too much, but you raise a very valid point. Thank you.
Oh, great. Well, thank you all very much, as always. I appreciate it.
Thank you all for tuning in, and for those going out hunting this weekend, make sure you be safe and good luck.